So good day everyone, I'm Maria Collis and now I'll be demonstrating the hot and cold compress therapy. So first is I'll be reviewing the doctor's order or verifying the doctor's order and I'll be reviewing the patient's chart. Okay, so next is I'll be gathering the equipment needed, which is the museum, towel, alcohol, and medical towel. So next, and also a good gloves. So next is I'll be identifying the patient. So ma'am, I'm Maria Collis. Good morning ma'am, I'm Maria Collis. I'll be your student from 6 a.m. to 6 p.m. Can you state your name as well as your birthday? Okay, ma'am, thank you. For today, I'll be doing a hard compress with you, and is that okay with you that I will be touching you? Okay, so I'll be can I check your ID band for verification purposes? Okay, thank you. So next is I'll be closing the door as well as the window for our privacy. So next is I'll be sanitizing my hands and put a gloves on. Okay, since I don't have a clean gloves or sterile gloves here, I already make sure that I clean my hands using soap and warm water. Also, I already sanitize my hands using an alcohol. So next is I will be putting a bed bath towel to the arm of the patient. Okay. So ma'am, pwede ko po ito sa right arm niyo. So next is we will be doing now the hot compress using warm water and the towel. So you will be putting this to the arm of the patient for 10 to 15 minutes. So of course is we will be doing that the right or left arm of the patient also. So after the 10 to 15 minutes, you can remove the bed bath towel. So after that is you will be monitoring what's the patient's reaction on the therapy that you did, and you will be documenting anything that may affect the patient or that may affect the patient. So next is you will be removing your gloves or PPE if needed, and you will be sanitizing your hands using an alcohol again. So that's the process of the hot compress, and now we will be moving on the cold compress. So next is we will be doing the cold compress, and assuming that I already reviewed the chart, the patient's chart, verified the doctor's order, I already gathered my equipment here, and I already identified the patient, and I already closed the door as well as the window for the privacy. And next is I will be sanitizing my hands using an alcohol, and I'll be putting a gloves on. Again, since I don't have a clean gloves and sterile gloves here, I already make sure that my hands are clean. And remember, of course, if you are in bedside, of course, you need to wear a clean gloves. Clean gloves. So gaya na ginawa natin sa hot compress, we will be putting a bed bath on the arm of the patient. Okay, so next is, of course, we need a towel, and we will be soak this on the cold water. Okay, so you need to put this on the arm of the patient for about 10 to 15 minutes. Okay, so of course, you need to do that on the left side of the patient, and after 10 to 15 minutes, you can remove the bed bath towel. Okay, so after that is you will be monitoring the patient if what's the patient's reaction on the cold compress or the therapy, and you will be documenting anything if there any irritation or any reaction on the patient. And next is you can remove your PPE or hand gloves and sanitize your hands as well. Okay, so that's the end of the presentation or demonstration of hot and cold compress.